Welcome to Namaste Health. Namaste Health is poised to be India's first real-time, location-based patient-to-specialist doctor video connect interface, which is meant to connect patients to a specialist doctor based on unique algorithm in the nearby locality, free of cost, instantaneously, so that a doctor is virtually available at the site of the occurrence of the event. Apart from this, we have other searches and connect in terms of value-added services, which make Namaste Health a truly 360-degree ecosystem for Health Connect. Namaste Health has been launched in both iOS as well as Android. And when you go on the home screen, you find this Namaste Health logo, which when you click, you would enter into the Namaste Health platform, which has a home screen of accident and non-accident flow. And based on what necessity you have, you will be connected. Now this is a non-accidental flow. Somebody has got a chest pain, and on the pressing that, if you choose the location, on submitting, you will find the doctors available in the nearby. And when the doctors are connected, there is a two-way doctor connect. The hospitals which are attached can be suggested by the doctor, and once this hospital is decided, a three-way connect can be taken to include the hospital so that the patient's condition can be explained to the hospital emergency department. After the call is disconnected and the doctor has given some advice as well as suggested the hospital, the patient can give a feedback, and patient gets a screen which has around 30 minutes of time for him to confirm the hospital. Once in the hospital, he can see the hospital location, hospital doctors, and the details of the hospital. On clicking that, he can reach the hospital. Simultaneously, messages are confirmed to the doctor as well as to the hospital that the patient is reaching, thereby making the hospital get prepared to receive the patient. If the patient wants a prescription, he can get a summary prescription for an illness for which the doctor has called later on. That feature is there. Or the patient can schedule an appointment later if the patient wants to schedule an appointment. In that case, a form opens and patient is asked to give preference for date and time, and that is submitted to the doctor, and doctor confirms the appointment or changes the appointment as the case may be. Now you can see it is either new meeting or follow-up. There is a provision of physical consultation as well if the patient wants. So we have kept all the possibilities into mind, whether there is a teleconsultation or whether there is a physical consultation, to make sure that patients get what they want. We also understand that at times doctors may not be comfortable with teleconsultation. In that case, teleconsultation is rejected and a physical consultation is only entertained or suggested by the patient. The doctor can assess all the documents of the patient while on the call to find if there are any illnesses. The patient can look at the appointments and find when is the appointment which is scheduled. So this is a patient screen in which he can look at the appointments. There are life-saving emergencies featured. It is the home screen, and on the home screen there up you can see the life-saving emergencies. There is the chest pain, breathlessness, high fever, unconsciousness. On chest pain, now omitting all the flows, directly the doctor is committed. The doctor can be connected in the vicinity so that we are omitting all the flows and directly we are able to connect to the doctors, thereby saving time. There is a unique feature of SOS wherein the patient can raise SOS and inform of his location to two of his relatives and our call center in case of dire emergency where he is not even possible to call. In that case, SMS as well as a ring goes to the relatives for them to understand. There is a unique feature of CPR, chest cardiopulmonary resuscitation, which can be demonstrated to the patient if the patient requires and the doctor has to suggest. So all these features add great value to the Namaste Health platform, especially the SOS function. Now this is the accident algorithm, wherein we can see life-saving accidents on the top contrary to the life-saving emergencies, and lower down we have other accidents. Now this is connecting to the hospitals, the hospital search. Once you see the hospital search, based on the specialties the hospital can be searched, or based on the hospital type. I will just come a second to that. These are the various, around 75 specialties are there. And then the hospital type, including the type of clinic, whether there is a Ayushman Bharat hospital or any government scheme there. And this is how it works. And patient can directly call from here to the hospital. On the hospital search, he can look at all the doctors and who are there in the hospital and the location as well, and he can reach. So the idea is so that the patient gets all the information at one single platform, and that is Namaste Health. You can change the location. That is again very important feature. That suppose you are based somewhere else and one of your relative is ill somewhere else, you can look for a doctor in that particular locality by changing the location, so that you get the doctors of that particular location. And that is one way by which you can, a person in the family can help each other who are not exactly nearby. There are various value added services, which are other services like air ambulance, like ambulance services, diagnostic, blood bank. Now this is ambulance service flow, where we have location based ambulance services which can be connected through our platform. Then we have blood bank, eye bank, premium services, second opinion, medical second opinion, wherein a small city person can be connected to a big city or a big hospital. Then there are do's and don'ts for the patient, wherein the patients are told what all things they need to adhere to in terms of ethics and what they are not supposed to do. These are the terms and conditions of our platform, which are also given in very clear terms to the patient. So at all time we want to be very transparent, that the patient is able to understand the terms and conditions. Then there are limitations of telemedicines as well, and that is where we want to show that these are the government guidelines, and here we are meeting with the government guidelines as far as their telemedicine or a remote consultation is concerned, where it is possible, where it is not possible, and the patients would understand and do well. Thank you so much. I wish Namaste Health will do good in the country and make a difference to the society in the best possible manner, and we plan to roll this out very soon and help the patients of our beloved country, India. Jai Hind.